Bismillahirrahmanirrahim. So our next topic is the approach of flaccid muscular weakness. Approach to the patient with the flaccid muscular weakness. Let's talk about this thing, right? So before that, I have gone through all these topics, right? So I have discussed the all the types of headaches, right? And I have very briefly gone through all those types of headaches. Then I have discussed about the multiple sclerosis, right? Then I have talked about confusion, right? Basically delirium and dementia, right? Then I have discussed the reversible and mostly I have discussed the irreversible cause of dementia, right? And then after that I have discussed the strokes, hemorrhagic plus ischemic stroke and strokes of anterior and posterior circulation, right? And the last topic was our the mixed upper motor and lower motor neuron disease. In that I have covered the mass mnemonic for that was a motor neuron disease, epiphytic ataxia, right, subacute combined degeneration and habeas dorsalis. So our sixth topic is this one that is called as the approach to the flaccid muscular weakness. So let's talk about this thing, right? Let me erase this data from here. All right, so let's talk about this thing, right? Right so if any patient is coming with the flaccid muscular weakness, so we're going to think that the patient might have the myopathy or patient might have the motor neuropathy, right? So it can be myopathy and it can be neuropathy. So how we're going to differentiate between these two? So myopathy usually this will have the gradual onset, and neuropathy will have just like sudden onset, right? So in myopathy, the mostly proximal muscles are involved, right? There is proximal muscular weakness, like shoulder and hip muscles are involved. While in neuropathy, mostly there is distal muscles are involved, like there is distal muscular weakness, like in gloves and stocking pattern, right? Obviously there is some exception like that of myotonica dystrophica, and in neuropathy you have this exception that is called as the GBS, right? All right, so in the myopathy, the flexors are more weak than extensors, right? So flexors are more weak than extensors, while in extensors and flexors are equally affected in the neuropathy, right? Okay, so we're not gonna see any sensory upsets in myopathy case, while we can see the sensory upsets in neuropathy case. And the very hallmark feature of to differentiate between a myopathy and a neuropathy is the reflexes, right? Is the DTR, right? Deep tendon reflexes. So in myopathy, the reflexes remain intact, while these are lost in the neuropathy. So this is a very hallmark feature of the how we're going to differentiate the myopathy and neuropathy, right? So so let's move on to the next page. So let's see. So to differentiate between myopathy and neuropathy, we can do deep tendon reflexes, right? So this will be intact in myopathy while this will be lost in neuropathy, right? So let's talk about approach to the myopathy, right? So let's talk about this thing. All right, if any patient is presenting with the flaccid muscular weakness, right, and the tendon reflexes are intact, so we can think about these diseases, right? If patient is having, along with that, patient is having easy fatigability, right? So we're going to think about myasthenia gravis, right? Obviously we're going to discuss all of these topics one by one, right? So okay, if the patient present with the flaccid muscular weakness and the intact deep tendon reflexes, and there are oddly enlarged muscles, right? M stands for muscles, right? So this M is for muscles. If there are the oddly enlarged muscles, so we have to think about a disease that is called as congenital muscular dystrophies. We're going to think about various diseases that include congenital muscular dystrophies. Alright, if the patient is having weakness, muscle weakness, and reflexes are intact, and the patient is having pain at rest, or there are the some tender muscles. If we touch them, patient gonna feel the pain. Or if patient is having rest but the patient is having pain, so this can be because of the myositis, right? So we have the following myositis like polymyositis, dermatomyositis. We can have the inclined body myositis. It can be because of the drugs, right? It can be because of ethyl alcohol, statins, steroids, chloroquine, cocaine, vincristine, and zidovudine. These are the drugs which are going to cause the myositis by causing proteolysis, just like steroids, right? Steroids are going to cause proteolysis, and that's how they're going to cause the muscular weakness. And if we check the reflexes, those will be intact, right? So if the patient is having muscular weakness, reflexes are intact, and there is sustained muscular contraction, so we're going to think about a disease that is called as myotonic dystrophica, right? If the patient is having sudden onset myopathy, right? Sudden onset myopathy, reflexes are intact. So this can happen because of the electrolyte imbalance, like hypokalemia and hyperkalemia, right? Hypocalcemia and hypercalcemia, right? So like we have the some diseases related to that, that is hypokalemic and hyperkalemic periodic paralysis, right? All right. So we have some systemic diseases like which are associated with the muscular weakness, and if we check the reflexes, those will be intact. So like Cushing syndrome, we're gonna see the muscular weakness with that. Well, we can see the weakness with hyper and hyper and hypothyroidism, and hyper and hypoparathyroidism, right? Both we're gonna see in these conditions, we're gonna see the muscular weakness. All right, so let me revise this again. So if there is easy fatigability, so this can be because of the myasthenia gravis. If there are oddly enlarged muscles, that is because of the congenital muscular dystrophy. If the patient is having pain at rest, so this can be because of the myositis, right? If patient is having sustained muscular contraction, this can be because of the myotonic dystrophica. If the patient is having sudden onset myopathy, this can be because of the electrolyte imbalance. Usually we see gradual weakness in these patients, right? Myopathy can be associated with Cushing syndrome, hyperthyroidism, hypothyroidism, hyperparathyroidism, and hypoparathyroidism, right? So that's all about the approach to myopathy. So in the next video, I'm going to discuss about the a disease that is called as the myasthenia gravis, right? So that's all for today.